CPI-482 is a potent LSD1 inhibitor with a novel mechanism of action. CPI-482 is able to induce differentiation and cause the cell death of leukemia cells. Now, in a cell viability screening assay using this compound with 350 different cell lines, it was actually identified that JAK-STAT mutant cases, or rather cases that are characterized by JAK-STAT pathway activation, seem to be particularly sensitive to this inhibitor, and that included HEL cells, SET-2 cells, UKE1 cells, and EOL1 cells. Using a xenograft model of SET-2 cells as well as HEL cells, it was demonstrated that dosing the animals with the compound, the CPI-482, versus vehicle was actually able to reduce the tumor volume in these animals. So that at least gave preliminary evidence that there was some efficacy with this compound in a xenograft model of human leukemia that's driven by JAK-STAT activation. So to further credential this, we went on to examine a murine model that we've previously reported of combined TP53 loss and JAK2 mutations, which results in a fulminant leukemia. We took mice with a JAK2 mutation and a loss of P53, randomized them to vehicle, the JAK1/2 inhibitor Ruxolitinib, or to CPI-482 treatment. And in fact, treatment with CPI-482 was able to significantly prolong the survival of mice versus either Ruxolitinib or versus vehicle. We noted that there was a significant decrease in the spleen size of the animals treated with CPI-482 versus Ruxolitinib or vehicle. And interestingly, histopathologic analysis demonstrated that there was marked reduction of leukemic infiltration in the spleen and the liver of animals that received CPI-482, which was not observed with ruxolitinib. And there was also a reduction in the fibrosis observed in the spleen and bone marrow of treated animals. Finally, and I think really importantly, we were able to see restoration of normal hematopoiesis in the mice that were treated with CPI-482. We saw, in fact, an increase in the lineage-positive population, which indicates that there is differentiation going on, as well as an increase in mature lymphoid and myeloid cells. So both in vivo and in vitro, we've been able to demonstrate in this study that CPI-482 appears to have a therapeutic signal in JAK-STAT activated leukemia models.